Yeah.
Nobody likes the front row per usual.
Sorry?
Nobody likes the front row ever.
Yeah.
How far back can I get? Thank you.
We're gonna have a group coming later. Oh, right. Yeah. Good morning, everyone, and we're here today to all become further enlightened about the Affordable Care Act. These ladies have come, they told me from Traverse City this morning, but they're from Gallagher, and they attempted to do a presentation, I think in September. They were on the superintendent's agenda for 20 minutes to do Affordable Care Act, and about 30 minutes in realized that we need a lot more time, so they graciously agreed to come back and do a full 2-hour presentation for us. And I'm going to introduce you by first names because I don't know your last names or can't remember them. So this is Tina Marie, Kelly, and Megan, and they're here, and I'm going to turn it over to them.
Thank you so much. Thank you for letting us come out here today to talk about our favorite topic, healthcare reform. We've been talking about this now for, 4.5 years, and where everyone is, we've kind of gotten through all the things we've had to do so far. We've, modified our plans as necessary. We may have changed some of our internal processes as necessary. So we thought this might be a good time to kind of step back and assess where are we today here in, almost all the way through 2014. What are things we need to be thinking about right now? What are things that are going to be on our radar screen in 2014? And then what's still left out there for the future? So we do have a slideshow that we can use as kind of our guideline to go over the overview. But we do want to make sure that we answer questions that are important to you. So we're going to leave plenty of time at the end. And then also please feel free to stop us as we're walking through. If we say something that doesn't quite sound right, or you want some clarification, some additional discussion, you want to talk about your situation, please feel free to stop us and we'll jump into that as we get there. I have a suspicion about a couple of topics that might be mostly of interest for you in the public school business. Let's just get started. All right. Do you want to?
So what we're going to talk about, again, this is an interactive format, and we've been doing similar things with a lot of your peers in the southeast section of the state. Again, just to talk, you can share best practices, what's working within your districts. We can hit some of those hot topic items for you. So what we're going to talk about, more is variable hour employees, because we know that is a challenge in the district. So you have segments that maybe are working, you're using outsourcing with a vendor partner to have them work in a segment, but then they might be a volleyball coach, and so they're a direct hire of the district. And what about these individuals, and how do you track their hours? So we know that's a hot button topic. We're going to hit that. We're also going to talk about some transitional guidance available for non-calendar year plans, because we understand a lot of you have mid-year plan years, maybe July versus January 1. Lastly, there are a couple things that are coming up deadline-wise. One is the transitional reinsurance fee. We have some great information on that. And the other, if you're self-funded, you have to apply for an HPID, Health Plan Identifying Number, and I will tell you that process is a hot mess, so if you're self-funded and haven't started going through that process yet, and you need to use it this year, we're gonna wish you the best in that, but I would say definitely start that process, because the deadline is actually next week, Wednesday. So you need to get right on that. So ultimately, right now, the time for action is now. There are some things that we've been talking about for 4.5 years that you kind of need to, you already know about, or you've been gearing up to plan for, but now is the time we have to start implementing some of those aspects. So I'm going to turn it over to Kelly, who will talk a little bit more about some of the issues impacting your district.
Right. Okay. So one of the sources of confusion with this law over the last 1.5 to 2 years has been about delays in certain provisions of the law. So what's been delayed, what hasn't been delayed, what's in force today, what are we really looking at in 2015? So we're going to do a quick look at those things. Provisions that have not been delayed, the individual mandate, the requirement that most American citizens and legal residents have qualifying health insurance in place, did begin January 1st, 2014. So it was the bottom line was go out and get yourself covered or face a penalty equal to either the greater of $95 or 1% of your household income. So that has not been delayed. The requirement that people get themselves covered has been in place since the beginning of the year. Along with that, the opening of the public marketplace. Here in Michigan, we've got the Michigan Exchange or the Michigan Marketplace. It is tied into the federally run healthcare.gov. That did open late in 2013 for effective date starting January 1st, 2014. We have Megan here with us, who spent a lot of time working with individuals to get them enrolled through the public marketplace during that month-long open enrollment period. Started off pretty rough last fall. If you remember, that website was not very reliable, but did get better as the process moved along, and ultimately the government reported that about 8 million people signed up through healthcare.gov. A bunch of benefit mandates did start to go into effect this year in 2014. You have all hopefully done all the things that you needed to do. This was the one where you got rid of pre-existing condition limits and you removed lifetime annual maximums on essential health benefits. So that's kind of all in the rear window now. And then new taxes and fees, we'll talk about those a little bit. Those started right on schedule, so we're right where we need to be on those things. But really, what was delayed, and at the time it was delayed, it was like, oh, we have a little bit more breathing room. But here we are on the verge of starting the new year. The employer shared responsibility requirements will go into effect in 2015. So these are the requirements that say, as an employer with more than 50 full-time employees, you are required to either provide qualifying health insurance to your full-time employees or face the possibility of paying employer shared responsibility penalties. So that is going to start in 2015. We did have a 1-year reprieve on that, but we're scheduled to go now for January 2015. Along with that comes the full implementation of the 30-hour definition for full-time employees, and then some new employer reporting requirements that are actually delayed now until 2016, but you're definitely going to be wanting to think about them as you begin 2015, because it's going to encompass activities that you're doing throughout 2015 that you'll be reporting on in January of 2016. So we'll go through all of these things as we move along here. So one of the things that seems to be pretty common, or what we hear a lot of talk about, are what are these penalties? And we hear about a $2,000 penalty, and we hear about a $3,000 penalty. And what are they? When do they apply? Am I going to be subject to them? So first of all, we're going to talk about the $2,000 penalty. And this is the penalty that would apply to a non-offering employer. The non-offering employer could be one of two things. It could be an employer that has more than 50 full-time employees that simply does not offer a qualifying health care plan. I don't think anybody in this room would fall into that category, but I'm a business owner, I have 75 employees, and I choose not to have a health care plan for my employees. That's fine. I'm a non-offering employer, but I will be subject to a penalty of $2,000 per full-time employee for the full year that I didn't offer them health care coverage. Now, in 2015, I'm going to come back to that in a second, sorry. The second category of non-offering employer is an employer who does offer a health care plan to their employees and their full-time employees over more than 50. That would be all of you, but if you're not offering this healthcare plan to at least, in 2015, 70% of your full-time employees, you could be subject to this penalty, even though you are providing healthcare to your full-time employees, those you designate as full-time. So how would this trip you up as an employer? If you take a look at your full-time employees, your teachers, your administrators, the people who come to work for you every day, the people that you have on your benefit plans, they're not a problem, right? But you may have some employees who work in your organization who you just think of as, oh, they're part-time, they're not going to be benefit eligible. But maybe they have a couple of different jobs within your district where I work 10 hours a week doing this, and then maybe some weeks I do another 10 hours doing something else, maybe it's only 8 hours, maybe it's 12 hours, and maybe I do something else over the course of the month. And maybe I'm stacking up jobs, and somehow I'm getting to an average of 30 hours per week between the different jobs that I've been in your district. If you're not counting those people, the government is going to count those people as potentially full-time eligible. So if you have a lot of those people in your organization, they're not being offered benefits, potentially you could be subject to this penalty if organization-wide you're not offering coverage to at least 70% of people who are averaging 30 hours a week. Now the 70% isn't terrible. Maybe most of you are thinking, we're just going to view those or a handful of those, we can manage those. The law was originally written to have a 95% threshold, and in 2016, we'll go back to that 95% threshold. So the 70% is only for 2015, it's a transition rule. So you might be able to squeak by in 2015, but when you get to 2016, if you've got some of those employees in your district that you're not offering benefits to, you've got a 95% threshold to meet in 2016. So that one starts to get a little trickier. Did you want to add anything about the stacking of jobs and all that?
We're gonna get to that.
Okay. Now the $2,000 penalty, it's written in the statute as $2,000, but it is indexed. So this year or next year might be worth $2,150 or something like that. So the $2,000 penalty number will go up. Now, in a funny twist of legislative humor, they apply the $2,000 penalty to all of your full-time employees minus the first 80. So in 2015, if this penalty were to apply to your organization, in calculating the penalty, they would look at your full-time employee count. Again, remember, anybody who's over 30 hours, not just the way you consider full-time. And they would pull out the first 80, and whatever number is left, that's times $2,000. As it was originally written in statute, it was minus the first 30. Again, it's a transitional rule, and getting people up and running. They're giving you the first 80 free in 2015, but by 2016, it will go back to the first 30 free. Okay, quirky little rule. But this is one to really, really be thinking about because, if you're thinking, all right, I've got all my full-time people covered, I know my budget, I'm good, but you've got some of these people working in the background. And maybe you put it out from the Human Resources Department that, we're not going to work part-time people more than, 29 hours a week. We just don't want to ever find ourselves in this situation. But there may be people within your organizations who need to fill classrooms or need to, get those coaching spots filled or whatever it might be. Gotta have people driving the bus or, working in cafeterias, working as classroom aides. And maybe you aren't able to, directly monitor all the hours that someone's giving to these people. It's really so important that you know who's out there accumulating these kind of hours, because if you get to, a year where you budgeted X dollars and then you find somehow you've got a bunch of these people out there that you didn't plan to offer benefits to, you have a decision to make, right? You either offer them some benefits or you're going to be looking at paying this penalty potentially. And that's on top of everything you already spend to provide health care benefits to your full-time employees. I mean, this could be your nightmare financial scenario. Yes.
So, example or scenario. So if we have 100 employees, 72 of them are teachers, administrators, support staff that do get our eligible benefit under our plans.
Yeah.
So there's 28 people that fall into this full-time category that we don't designate as eligible benefit.
Yeah.
For this next year, we are good because, and then actually in 90 or the next year, because there's under 30, there's 28 of them. We're still good, right? We would pay a penalty.
Okay, well, you potentially would pay a penalty. So in your example, in 2015, you're fine. You've got 100 employees, 72 of them are full-time and benefited or offered benefits. 28 of them are not. You pass the 70% for 2015, no penalties there. If the next year that threshold goes up to 95%, and you still have 28 people that are full-time but aren't benefited,
But isn't it minus the?
it is minus 30, but it's based on your entire population. So it's 100 people minus 30. Now you have 70 people left times $2,000. So it's not just you get to pull out the 30 who aren't eligible, you apply that penalty to every full-time employee.
So even
that's
though
where
you're
it becomes
offering
problematic.
benefits to those 70 individuals because you don't meet that 95% threshold, they're gonna look at your district and treat you as an employer that is not offering benefits. So you would be subject to this $2,000 penalty times 70
So
employees.
143.
Yes.
Right, on top of, again, everything you're already spending to provide benefits to your full-time employees. This is why we say this piece is so critical. You need to understand who your part-timers are, people you might consider variable, people you might consider seasonal, people you might consider temps, whatever you want to call them. It kind of doesn't matter if they're working for you throughout the year and are stacking up enough hours to ever get to that 30% or that 30-hour threshold measured over an entire year.
And we
So
want
these are
to
ones-
dive into that a little further as a group, because that is the biggest challenge that we have heard from your peers here in the states that we've talked to, that they're facing, because they have a segment of those employees that you've never offered benefits to. Maybe they're your paraprofessionals, maybe they're your classroom aides, or maybe there's a segment of employees where you might decide, even at the end of the day, you still don't want to offer benefits to. It's making sure that you look at the big picture to say, okay, what we're doing inadvertently won't put us in that $2,000 penalty area because, you know, you're doing all these other things for all your other employees, and then you're exposing yourself again to another, you know, in your situation, potentially $140,000 assessment at the end of the calendar year. Yes, in the back.
But when we use the word offer, we could allow any of our employees to buy into health insurance, and we would skip the issue here and maybe have an affordability issue later.
And that is a good approach to take. So an offer of coverage is exactly that. You are offering coverage. So as long as you offer coverage to at least 70% in 2015 or 95% in 2016, you're in essence avoiding the $2,000 penalty. What will happen is if you offer coverage and it's not affordable, and that's the next slide, right? Right. You offer coverage that is not affordable, which means that cost of single premium is greater than 9.5% of single employee wage for the purpose of this affordability plan. Or the plan does not meet what's called minimal value or 60% actuarial value. And from my understanding, for every school district and public entity I've ever looked at a benefit for, Kelly, correct me if I'm wrong, they meet those standards. You offer very rich benefit programs. So if you don't meet that affordability aspect, in the case that you just brought up, you would be $3,000 penalty for every employee that goes to the marketplace and gets a subsidy. So they contact Megan, Megan signs them up, finds out that they're eligible for subsidy, and then they're going to come back to the district and say, okay, you're subject to $3,000 penalty. Now that might be an approach, and you have to look at what's the best strategic approach for our district from a business perspective. And I always say the path to least risk. That might be a viable approach if you have this one segment, which at the end of the day, you know, we just can't offer benefits to them, or maybe it's that small group of 28 individuals that he brought up. And maybe that's more of a feasible option than 2,000 times 70 to be that $140,000 threshold. But that is one approach you can take. And there are some of your peer groups that have decided to take that way, and that doesn't necessarily mean it's wrong. It's a choice you have in your district.
Right, and these are all things that you really, really have to kind of put on the table to think about, where am I most exposed here? Because, for example, if I just say, I know I've got employees that meet the requirements, I'm not going to offer them coverage, I potentially have that $2,000 or $140,000 nut on the table in your case. If I'm an employer who says, well, what the heck, you know, I'll offer coverage to these 28 people, you know, we'll see what happens. I offer it, maybe I say, I'll offer it, but we, the district, aren't going to pay one penny for it, so it's fully on your dime. You offered coverage, right? You're good, you avoid that $140,000 penalty. But a couple of questions. One, how many people will take that offer of coverage that you didn't, you know, necessarily plan to have in your plan? Even though you're not directly expending money, if your plan is self-funded or if it's experience rated, you're bringing some new people into your risk pool that maybe you we're planning to have in there, so that's something to think about. What was the other thing I was gonna say there?
I think Megan's gonna go with that or bring
Well-
out that might be a good option for that employee. It might necessarily be a good thing for them to go to the marketplace and be eligible for that subsidy aspect.
Well, I guess that's the other thing. If you take that approach and say, we are gonna offer you coverage, then if it meets these requirements, if you say we're gonna offer you coverage kind of on the same terms that we offer to everybody else, so we're gonna make it affordable, we're gonna make it the 60% actuarial value, and it's still pretty expensive for them, the fact that you're offering it and it's affordable and it meets the standard means, even if they wanted to go to the healthcare exchange, they couldn't get a subsidized plan there. So that protects you as a district because no $3,000 penalty, right? That triggers when one of your employees who is offered coverage, either not affordable or not minimum value, goes to the exchange, gets a subsidy, and you could have offered them coverage, you chose not to, you get a penalty. But if you say, I am gonna give you coverage that's minimally, meeting that standard and just barely affordable, you've cut off their access to get any kind of a subsidy in the healthcare exchange. So you kind of have to think about what's right for you as an organization, what's good for these individuals. Then the other kind of wild card in all this is if you decide to make a blanket offer of coverage to a bunch of these people, what you don't know is how many of them would say, I'm covered through a spouse or a parent or some other thing, I don't need your coverage. So you're safe there, right? You made an offer of coverage but nobody took it, versus I'm gonna make an offer of coverage and oh my gosh, look at how many people took it. So this is where you really do have to kind of understand your population. You really have to know the kind of folks you've got in this bucket of these people who are hitting these 30 hours. How many of them would be likely to join on board your plan if indeed they were offered that opportunity?
And we only have to offer single, 60%, correct?
You have to offer, to be considered a qualifying offer, it has to be offered to employees and dependents defined as natural children and adopted children up to age 26. You don't have to offer spousal coverage, and in where those work, you don't have to offer coverage to stepchildren or foster children, which most people do. You don't have to, but to be considered offering has to be employees and their
And it
dependents
does
and
not
adopted children.
dictate that you have to pay for any coverage. You make it offer it, and you can say, we're offering it, you pay 100% of the cost. That's an offer of coverage. There's no dictation on the amount of premium contribution you as the employer have to make. There's no designation for that. So as long as you give them the option to enroll on your plan, even if it's at the full cost, and you maybe have contribution towards single, so you'll cover the entire premium for the single or a portion of that single coverage. That's all basically you're meeting the offer.
But under the 60% actual, can't we offer single coverage with the ability to pay up for dependents and spousal and only pay for 60% of the value of single coverage?
Well, what the actuarial value is the coverage itself. What does it cover? So they look at in the marketplace to compare it to what a bronze level plan is. So it's 60% of contribution towards the coverage services that are offered.
Right, most insurance companies are coming out with 60% actual.
I mean, again, every
But if you want
district
to
I've
stay with
seen.
your current coverage, you can offer 6% of your single with the ability to enroll and pay for the rest up.
The contribution for the employees is not really tied to the 60%, it's tied to the 9.5% of income level. So if you say, for example, we want to subsidize single coverage enough that we meet the 9.5% standard, basically to do that, you would take a look at the wages of your lowest paid person who's eligible, who has 30 hours. And you would say, whatever they're making, if I keep my single contribution at 9.5% or less of what that person's making, then it's affordable for that person, and then by definition, it's affordable for everyone else. Then you could do it that way. So you force it to be affordable and completely, have them pay up anything above that. So you want to cover your spouse, 100% you're done. You want to cover your kids, 100% you're done. You can do that and still meet this test. But bear in mind that you may have made it affordable then for your employee, but they'll look at it and say, wow, really unaffordable to cover my spouse and kid. They could go to the marketplace and they can't get a subsidy. So the question for you is, are you helping yourself? Are you helping these employees? How do you balance that out? Are these employees that are valuable to you that you really want to not get tipped off and leave you? Are these employees who are like, not you, it's you, not you, whatever? You really have to kind of think. If you're putting them in a position where they're okay, but their dependent can't go and get subsidized coverage, you know, where does that leave them feeling, or how does that leave them feeling about you?
And where's cash and lieu come into that?
Cash in lieu is just a section 125 benefit as it is now. You're still offering coverage. If they decide to take the cash instead of the healthcare, you've offered coverage, you've met your obligation there. Did you want, I'm sorry, I cut you off.
No, that's
earlier.
okay. I was just gonna say, in this scenario, you know, let's look at your 28 employees. If you could probably give your best guess about how many right now are either covered, you know, under a spouse's plan, how many are single and likely to go to the exchange and get a subsidy. And we do this with a lot of our clients where we can look at that segment of your population that you plan to not offer coverage to and probably find out what your exposure is for this $3,000 penalty. Now, you don't know what the household income is for all of your employees, but you'll know if they have like a working spouse that they'll most likely not be able to go to the exchange and get a subsidy. But bear in mind, there's probably a handful of people that, you know, if you assess that $3,000 penalty for them throughout the year, if they're a good employee and they can go to the exchange and get a subsidized plan and get good coverage where they couldn't before, I mean, that might be something that's an advantage to them, whereas, you know, you offering them a health plan might cost you a lot more than that $3,000 in the
That's
penalty.
the other little wild card in here too, is you're not obligated to offer these people the same health plan that you would offer to your teachers or your administrators or your superintendents. I mean, there's nothing that says you have to have the same plan for everybody. There are some employers out there who are thinking about putting in a very 60% bronzy, minimally passing kind of plan to say, here's the plan that these people, you know, that would otherwise not have been eligible historically get access to. You can make it affordable or not affordable, depending on what penalties you're willing to do. So there's nothing that says you have to treat them the same as everybody else. So that's another strategy that, I mean, these are all different things to think about. Again, where am I most exposed financially? Where are the surprises that could come to, you know, hit me financially? And then what's the impact on these employees? Again, these are people that you are counting on to, you know, be in the classrooms, parapros, and you know they're hard to recruit, and you can't just cut their hours and be able to find a whole pool of other people willing to step in and work 25 hours a week. You have to, these are all the things you have to kind of throw into the mix and consider. Okay. If you have a non-calendar year plan, all these requirements go into effect January 1st, 2015. But if your plan renews on a non-calendar year basis, there are a couple of different ways where you kind of have to run some numeric tests to determine, does your plan become subject to all these rules on January 1, or does your plan become subject to all of these rules on the plan anniversary date? So let's say your plan renews July 1st. And in 2015, would all of these things apply to January 1st or July 1st? And without getting into too much detail, because it's really kind of gruesome, there's several different steps to go through to evaluate which date applies to you. The first one's kind of easy, but I don't think it's going to apply to most folks here. You have to look at, did you have a non-calendar year plan in place as of December 27th, 2012, and do you still have a non-calendar year plan in place? Probably you do. You have to take a look at the date February 9th, 2014, which is the date this guidance came out, and say to yourself, if all the people who were eligible for coverage on February 9th, 2014, is the same group of people who will be eligible for coverage on the first day of your plan year in 2015. So, hey, we met, everybody who was full-time was offered coverage then, everybody who's full-time will be offered coverage first day of my plan year in 2015, then you automatically qualify for this. You get the transitional relief, which means penalties don't begin to apply to you until the first day of your plan year in 2015. Well, probably that's not really going to be our issue here, because we know we might have some of these part-timers, these variable hours people who weren't eligible on February 9th, 2014. We didn't have to cover them then, who may be eligible in 2015 because of some things that we might decide to do within our districts. So if that pool of people looks different on February 9th versus the first day of your plan year in 2015, then there's a series of these numeric tests, which again, we won't get into in here, but we can talk to you about those, that you have to run through, and like what percentage of them were covered or eligible and on different dates. It's really kind of a big spreadsheet sort of process. But that will tell you whether or not any of these penalties would begin for you on January 1st, 2015, or the first day of your plan year in 2015. So again, not gonna belabor this one, that's what this slide says too.
So we did provide that information for you, and wanted to chime in that the reason they did that, and it necessarily didn't impact your peer group, but what employers were doing is they were getting creative, and they might have had a January 1st plan year. And what they did was they moved off their plan year to December 1st to avoid or delay the impacts of all these required mandates, and the government caught on and said, no. So they went back, and that's why December 27th is such an important number, because that's the date they decided they were going to do this. And then they actually released the guidance on February 9th. So it wasn't designed to impact your peer group, but I will tell you, a lot of employers said, hey, we're going to get around this by delaying it until the December of 2015 if we move our plan year and renew or make our plan year 1 month sooner in the plan year. Yeah. Sure. There are several categories or classifications of employees. And again, most of these do apply to those in the school district setting. So you have your full-time employee, which they classify for benefit eligible purposes. And the reason I say benefit eligible, because there's nowhere in the guide that said full-time is 30 hours. But for benefit eligibility, they're saying 30 hours. So you can still have a full-time employee classified as 40, but your benefit eligibility must be based on 30 hours. So we have full-time benefit eligible at 30 or more hours per week. We have those part-time employees, which we crack jokes and say it's the 28.5-hour rule, which a lot of your peers are implementing, try to manage those hours. So those working less than 30 hours a week. Then we have this big pool of variable hour employees. So if at the time of hire, you cannot, on a reasonable basis, know how many hours they're working. So we're looking at those lunch aides, those job stackers, those that are working substitute teachers, or other segments in your districts, bus drivers, that may not, they may work 10 hours a week. We heard a term that I've never heard, but from a peer district, cyber employees. So they're working in an online virtual environment. And they would say, well, they work 365 hours a year, but we'll get payroll on it's 10 hours 1 week, and then 2 weeks later, it's 45. So those employees where you really don't know how many hours they're going to be. We have to track those employees, and we're going to try to help you through that process, because that's the employee base you need to be concerned about. Then there's seasonal. And I like to compare, even though the Tigers are out of the playoffs, but let's just say somebody's working at Comerica Park, and it's only open April to October, so 6 months out of the year. If they're reasonably expected, the duration of the employment cycle is 6 months or less. So they're working at a golf course, or they're working at Comerica Park. Then they're considered seasonal. There's a difference between seasonal employee and seasonal worker. So if you're working in retail at Kohl's during the Christmas season, you might be considered seasonal, but they're looking at seasonal employment as that every year I'm going to come back on April 1st and I work April to October every year. But they're still an ongoing employee. So there's also some additional aspects. They took a look at educational employees. Unfortunately, they looked at higher ed, and they looked at adjunct faculty, and they said, okay, we can treat them with a specific number of hours to designate. They looked at those members of the religious and on-call employees and airline employees and said, we're going to give them specific guidance. But unfortunately, they still have not looked at your segment directly to say, here's how we treat your service staff. So those are the 4 buckets employees will fall into. But again, you're primarily going to deal with full-time, part-time, and your variable hour employees. The challenge is, and we heard this when we were out here in September, is what about we use outsourcing? We might use EduStaff. We might use PCMI or, yeah, the 4 of them. But we might have that outsourcing partner, and we go to them for our substitute teachers. So what if we have this contract with them, and we're using them on a temporary basis, and they might work for the district 20 hours. But then they're also working in our athletic department, and they're volleyball coaching. And one came up when we were up here, so we like to use that example still. Whose employee are they? And right now, as of we know this morning, when you look at your relationship with EduStaff or your outsourcing partner for those employees, you have a contract between you, the district, and the contract, your service provider, for that regard. So that's their employee. The muddy gray area happens is when you have the right to hire that employee, discipline that employee, terminate that employee. And under the realm of the definition of employee-employer relationship, who do you think the IRS or the government entity is going to look at for who that employee belongs to? It's going to be the district. So there are some, we've heard this from talking to some of your peer groups, where there might be that relationship. That relationship is more where I get concerned about as far as who that employer-employee relationship belongs to. But traditionally, when you have that segment, the 20-hour week, there's substitute teacher or working a project base for you. Look at your service contract between you, the district, and that entity. Some of these things should be clarified because they'll be the ones that are responsible for managing those benefits right now.
And if they're considered the employer and they're sending somebody out to work in your district as a substitute for X hours per week or month, and then sending them to another district, they may be getting to above the 30-hour threshold, not necessarily all within your district. They're looking to that EduStaff or whatever as their employer. They may then come back to you and say, we need to change the terms of the contract and what we're billing you for these people, because we now are on the hook to offer them health care. We know some of them will take it. Our costs will go up. That's going to be reflected in the rates that we're charging to you.
What they're trying to avoid, and again, we'll see things as we start going through the process next year when these things actually start apply in reality, is what they don't want you to do, or employers to do, is split, say, I'm going to work 15 over here and 15 over here, and say, okay, in this bucket, you're working at outsourced company, and then in this bucket, we're working here, but total, it might be 30 hours, but since it's two different buckets, it's not applicable. They don't want you to use that to avoid obligations, and they may scrutinize that a little more going forward. So those are some employees you just want to make sure you don't lose track of. Again, from the outplacement firms that we've talked to, just to gauge how are you working with your district, your partner districts, how are you managing that? Most of them said we're going to track it. If we do have somebody that's benefit eligible, the fee's going to be assessed back to the district, or we're going to have that contractual relationship. But just kind of make sure that that goes in that, because they're in your variable hour bucket, to make sure that you're keeping an eye on that. Because let's just say they do have a situation where they're an employee of your district, they're working in the athletic department, they're that football assistant coach, or they're doing seasonal volleyball, or they're doing some form of coaching staff that's for a short period of time. And then they become your employee and they do something else, but you might have to track where they are at in those different buckets, because let's just say you direct hire them at that point and they've been working for EduStaff, those hours are going to count and they might be benefit eligible sooner than later.
The other tricky thing here too is sometimes you hire these people for a short duration. For example, I'm the assistant football coach. I'm a seasonal employee, right? Because I come in at the beginning of football season and I'm gone at the end of football season. Unless I then decide to be the summer or the wintertime basketball coach. Or I'm also, maybe I'm getting some classroom hours as a parapro or something like that. If you have people that are strictly seasonal and hire them for the football season and then they're done, you're okay. You don't really have to worry about those people. But if they stick around, if they have some job stacking going on at the same time, you're paying them a seasonal rate. You're not paying them an hourly rate or a weekly rate or a monthly rate. It's X dollars for the whole season. But then you have to go back and track it. You have to be thinking about these things too, because all of those hours will count into whether or not they were meeting 30-hour threshold balanced over an entire measurement period.
So, question with the seasonal employee like that is that, let's say the football coach, you say, well, it's 3 hours a day times 5, that's 15 hours and that's it. Or is it the number of hours they actually put in that they record themselves, which is 60 hours?
Right, of course, but during a short season.
Yes. So whose hours are we counting? Because we're paying them a stipend for that.
Right.
In essence, I kind of I'm going to compare that to the higher education with adjuncts. And I can say that because I am an adjunct at a college and I get paid a flat fee rate for my class. So I'm teaching 12 weeks. Here's how much we're paying you. They equated that to every classroom hour. The guys came out and said, we're going to equate that to 2.25 hours for that to be recorded for the purpose of tracking hours for recording purposes. I can tell you, maybe I'm just devoted as a professor. I put more than that 2.25 hours in when I'm teaching, and I assume it's kind of the same aspect, you pay them, maybe it's a contractual basis, we agree to pay you X per season. And you have to find a way to equate that to the number of hours worked. What they don't want is under-reporting, and it sounds like, okay, we're saying works 3 hours a day, but he's coming back and saying I'm working 60 hours, which could be the case. They don't want under-reporting to avoid having to offer them benefits. But what's good is we can pretty much gauge, we know, of course, maybe you have some teams in the playoffs, good for you, but typically you know the duration is like August to end October unless they get into the playoffs. So you have a short period of time. So if you treat them and count those hours, they might fall into this bucket of variable hours because they're not working all year and wouldn't otherwise meet eligibility. Does that make sense? So you know they're there for a short period of time. The challenge comes is when that athletic coach decides to go work in another sport or goes and does something else in the district, which not uncommon, sometimes they're substitutes or they have other jobs within your school district. And then you want to make sure you're not missing them in your count and making them benefit eligible. So typically I would say if they're just working at one sport, they're going to fall into seasonal, you're okay. But I would just make sure that you're not grossly under-reporting those hours based on what they should be.
Well, and this is one of those areas where, like some of these other categories that you see on the bottom, additional guidance has come out because organizations like this will say, we don't know how to do this. You know, when the law was originally written, nobody had factored in there's a bunch of adjunct faculty members working at colleges. And so they didn't give us a way to account for the hours of those people who are paid on a per semester or per credit hour kind of basis. In guidance that's come out since then, they came back and said, first of all, it was sort of like, well, you know, do your best, make a reasonable, rational kind of judgment about how many hours does that really equate to. Well, you know, what does that mean? Then they came out with guidance specifically that said you get the 2 1/4, 2.5 hours, whatever it is, for each classroom hour. So same thing with bona fide volunteers, on-call firefighters. Guidance has come out subsequent to the original drafting of the legislation that's given us some more clarity around those issues. So it's entirely possible that at some point we'll get something very definite about that. It just hasn't happened yet. So in the absence of that, the kind of overarching rule here is, you know, good faith, common sense, rational, reasonable, whatever you think you could defend if you ever had to defend it.
Split the difference. There's 60, just come in at 29. No, that's just me being polite. No, I mean, try to make your best good faith estimate. If as a district you honestly are saying, okay, honestly, this is where this should be, then at least you have a business case to support your rationale if that were otherwise questioned. The challenges. There are so many challenges in your peer group because, again, if you look at ACA as a whole, you know, they made a lot of general assumptions about the average employer. Like everybody had a calendar year plan. Everybody had standard, you know, employees. Nobody had this variable hour bucket, which came after the law came into effect because it was like, oh, that doesn't really fit me. There's not a one-size-fits-all approach. So one of the biggest challenges that you as a district face are those job stacking, which we kind of hit also, but not all your employees work 365 days a year or 12 months out of the year. You have breaks in service. You have summer break. You have holiday breaks. You might have other breaks that come up during the year. So what do you do with those summer breaks? So you have employees that work to mid-June. They come back at the end of August. You're not paying them all year. Maybe you are, depending on your payment situation with your staff. How do you treat them? And thankfully, they gave us some guidance. Says, you know what, we recognize schools have this scenario. We're going to give them some guidance on how to treat your summer breaks or those breaks in service. But you do have individuals, admin buildings going to be open most of the year. You have facility staff, etc. So you do have some employees that you need to treat differently than your standard school staff. Collective bargaining agreements. How many of you have maybe a multitude? It's not just one CBA you're working with. You have the teachers union, you have your food service workers, you have your bus drivers. You have multiple CBAs that all negotiate terms of employment with you differently. So not only do you have to look as a whole to say, okay, we got to comply, but how do you factor in the CBA agreement when you're negotiating these years out and they're effective years out? So maybe you want to add a base plan and you want to have some changes, or maybe you have to add some coverage that's not available today. How do you address that with your CBA without creating labor issues? One approach that we have seen, some of your peer groups and just groups and employers in general that have a CBA, is to put language in there to allow you to reopen specifically for ACA compliance. Not open the entire terms of your CBA, but you understand that regulations happen. And I guarantee you, if I looked at my email today, something happened this morning. That's what happens today. But some guidance come out that you need, as the employer, to have that leverage to be able to meet compliance. Not an attorney, but I know you work with your counsel that works with you in regards to those negotiations. They may be able to help you with an option. And it is an option that we found some districts have taken during that process. Because fortunate for you, your unionized member segment of your employees they understand this is coming. This isn't like something you're coming up with the district to use as leverage to say, we got to do this. They're well aware from an educational standpoint about some of these challenges. So you'll find that it's more palatable than other terms you might be able to negotiate. Here's the other big piece, and it's a logistical nightmare for not just your segment, but a lot of employers, is how do we collect all this data to be able to comply with the reporting requirements? So now, coming up in tax year 2016, you're going to have to track by month. I offered coverage to these employees this month, this month, this month. And there's a special form for that. And the IRS continues to tweak it. So now we're in our second draft, which I anticipate will change. But the form is going to ask you to say, I covered John Doe. And if you covered the dependents, again, coverage, here is Jane Doe, SSN. Here's Billy Doe. Here's Sally Doe. We offered them coverage January, February, March. How many right now actually have SSNs for dependents? We have one in the room. Good for you. That's good, because it's a challenge. Most employers don't collect that data. So they don't necessarily have that, but it's required on the form. We have just come out. We have these smart people that when I want to talk to another smart compliance person, we have this team of compliance team that we work with at our corporate office, and we just came out with some information to help walk you through this process, which is amazing. It's a tool available. We can get that information to you. We'll email it to Linda to get it off to your peer group. It's hot off the presses, which is why we don't have it this morning. It literally just came out because they keep changing the form. But if they keep changing the form and you need to start collecting this data in January, it's now, it's November 1st on Saturday. We're all kind of bundling through this together. So that is one challenge, is A, how do you logistically as a district, when you have different entities, you have different buckets, different CBAs, you may have centralized payroll, you may not. Maybe ABC school is not, you know, sharing information with this department, or maybe you have individuals working in those different jobs that you need to collect all this data for. So that is a logistics issue. So not just tracking it, so you can gauge who in this bucket is eligible so you don't miss anybody, but it's the reporting aspect starting tax year 2016. The other piece is, guess what? You know, you issue W-2s to employees. Why? You want to show to the employee, this is what I reported to the IRS about your wages and different information. So when the employee goes to file their taxes, they confirm or substantiate that. So when you go to file this information with the IRS, they're called Forms 6055 and 6056. Then you need to provide additional information to the employee to say, hey, John Doe, I reported information about you, Sally, Billy, and Jane. Here's what I provided to them, and it's going to be similar to what you provide with W-2s. So another piece of compliance that you'll need to have, and again, this is for tax year 2015. So January 2016, you reported this information. There's another piece that you'll have to provide for your employees.
We're going to talk a little bit more about that reporting kind of at the end of this presentation. So it's nice and fresh. Yeah, keep going.
Okay. So what do you count as far as hours? And this is a big challenge. We were up in Traverse. We've been on the road doing our little road show, having similar conversations with groups like yours. And we were with a group that had very similar challenges as districts do. And so the question came up is, what do we count as an hour? And it's any hour that is paid, even if services are not performed. So if they get paid, so I have performed service, you pay me for my 30 hours I work. Jury duty, holiday pay, sick time, disability, and disability meaning you have a payroll practice where you are physically paying an employee when they're off. Layoff time, jury duty, military leave, or any other paid leave. So they're receiving that in the form of a check or payment from the district. You can look at different ways because hourly, it's pretty easy to gauge. They work their 30 hours, we know they work, we pay them. For exempt staff, so those that can work the 60 hours and we still pay them their standard rate of pay. You can look at a day's worked equivalency or weeks worked. So you can assume for an exempt employee, for every week they work, you just count 40 hours, so 52 weeks, whatever, they get their 40 hours. Or you can say for every day we pay an exempt employee for, or even if I work 1 hour today, you're going to count it as days. So your hourly staff, pretty cut and dry, you're paying them based on their work. But for your exempt staff, you need to look at, am I going to treat it for every day they work? Or am I going to look at, assume they're going to work the entire week that I pay them salary? So those are your 3 options. So here comes a challenge, and this always is a great discussion. And I'm a visual person, so I like to show this visually because if we try to explain this to you, it's very complex. And this is looking at those variable hour employees. So those employees, they're working as lunch aides, they're your after school programs, they're your substitute bus drivers, they are other buckets. And you don't know that they're working those 30 hours per week. So for one time only, as we ramp up into 2015, they allowed this one-time measurement period where they said you can have a 6-month measurement period where you don't have to go back 12 months to look to see who's eligible when this applies to your plan, let's just say July 1st next year. You can use a 6-month period. And from your peers' perspective that maybe implemented some changes to their scheduling or put more controls in place, they were very happy because they might capture less people, that less benefit eligibles doing this than looking back the entire year. So in this situation, this is a calendar year plan. So instead of looking at 12 months to count to see if Jane averaged 30 hours over the course of those 12 months, they're going to look at a 6-month period. So they're going to count May 1st through October 31st. So at this point, you can have what's called an administrative period because we all know if we're looking and at this, analyzing the data, who's eligible, who's not, we got to enroll them on the benefits, we got to communicate them, they're enrolled. Also, let's just say they're on the benefits and are no longer eligible, we have to tell them they're not. There's an administrative period that you can have up to 90 days. We're seeing 60 is pretty much a good average of what employers are doing. So in this case, counted them for 6, the period was May 1st to the end of October. November 1st starts the administrative period, so that gives you time to see who's eligible, do all those things. Coverage is going to be effective for January 1 for a 12-month period. Yes?
Can schools use that same period? That would include summer break?
Summer break works a little differently. And, you know, some districts will be like, yes, we don't have to count it. So if I look at over the course of 12 months and they're not working for 3 months, they're not going to be eligible. How they look at summer break?
I think there's actually a slide.
Yeah, we did put a slide. You read my mind. It looks at consecutive break periods of 4 or more consecutive weeks. And when they drafted this, we literally got very excited. It says, wow, they actually acknowledge that school districts are different. So kudos for them. So they looked at, you can still use a 12-month measuring period. So if I went back that January 1 to the end of the year or the one-time 6-month. But you have 2 options of accounting for breaks in service. But if you work during the active portion of the academic year as seasonal employees, you can not wait. employees who work during the active portions of the year as seasonal employees cannot be treated as seasonal employees. So if you work for, like the football coach we talked about, that worked more outside of the football season and then picked up all other aspects, you can't say, well, he's seasonal, we're not going to count him as a variable hour employee. So they did identify that in this section. So we're looking at breaks in service. We're going to throw out the individuals that are working at short football season. And we're going to say that if a break is 4 or more weeks, you can't penalize your employees for that break off. You want to,
Right. So how, and this kind of applies to other breaks also that are unpaid. For example, if you've got somebody who's using an unpaid FMLA leave. So during the course of this, again, most times we're going to use a 12-month measurement period. If they're off for summer, you don't count those break periods as 0 hours. You just don't count them.
Mhm.
So if I'm measuring over that full 12-month period and I have 2.5 months off for summer, I'm really getting a 9.5-month measurement period. Because I'm not counting the 2.5 months as 0 hours worked for those people. I'm looking at the hours that they actually worked during the time that we were open to have them work.
and that is unique to your segment. ABC Manufacturing Company cannot do that. So that is one unique thing they've done to address your situation with having summer break.
Now, if you've got these hourly, these variable hours type people, we're coming up on Thanksgiving break. You don't have to give them credit for days that they didn't work Wednesday, Thursday, Friday, Thanksgiving week, because it's not a break of 4 weeks or more. So if those folks aren't being paid for the holiday or the Thanksgiving weekend, they're not being paid during your winter break, your December, January break, or maybe a February break, a spring break. Those, you don't have to worry about those, but where the breaks are 4 weeks or more, you just basically carve that time out of your measurement period and don't count it as 0 hours worked.
So you're going to use, determine the average of hours per week during the, and exclude that employment break, which usually winds up being approximately 9.5 months, taking out summer, and that's going to be their average. Or you're going to credit them with specific hours for that break, but it cannot be no more than 501 hours of service. So you can do an average of the 9.5 months, or give them hours as if, treat them as if they worked. So if I'm an exempt employee, you're giving me 40 hours per week, you're going to give them that 40 hours per week for that break. So June 15th to end of August, but that credit you're giving them cannot exceed 501 hours of service. So you have those two options to count for those breaks. Another aspect that we wanted to mention is, let's just say if somebody is a variable hour employee and they just started with you and November comes along and they need to go out on an unpaid leave. So they work August, it's now November 1st, and they're going to be gone for 6 weeks. And it's an approved leave of absence. So if their leave of absence exceeds their tenure, so it's greater than 4 weeks, but that leave that they're gone exceeds the number of weeks they've worked for you in the district, then you start counting them over again. So you're not going to account for that time off. You're not going to give them credit or not, take that into account in your measurement period. You're going to say, we're going to start over. So Jane came back mid-January. January starts that measurement period over again. So your 12 months goes forward. If it is greater than 13 weeks, you're going to treat them as a new hire anyway. For educational employees, it's 26 weeks. So this would be the standard employer, and it's 26 weeks for your peer group.
Right, but there may be employees in your district that are not considered educational employees.
Mhm.
People who do work all year round, they would be treated as non-educational employees. Educational employees get the special
So
26
your
weeks.
facility staff, those that are working in your, let's say, administrative staff in your buildings that are there working at your district that aren't off during the summer breaks. Right? Now, the one thing we also wanted to mention is FMLA and USERA leaves are credited for average hours worked during the absence.
Paid leaves.
Paid leave. So if they're on a paid FMLA or paid USERA leave, you would treat that differently. So think of it again, I like to equate this as what they're seeing in that paycheck. If they're receiving a check from the district, payment from the district during that time, they're using their paid time off or some other aspect, you're gonna treat them differently than if somebody has a break in service for a non-paid leave.
All right, dependent definition, we talked about this a little bit earlier. So to be considered an offering employer, you need to offer coverage to your full-time employees, those working more than 30 hours a week. Again, coverage does not have to be offered to spouses, foster children, or stepchildren. Your plan would still be considered qualifying. Now, from a TDA perspective, from a recruiting perspective, and an employee happiness perspective, that's probably not going to work. And even in the private sector, nobody's defined their plan to only say employees and certain children. But you do have to offer it to biological children and adopted children up to the age of 26. And one point of clarity that came out recently is that you must offer coverage through at least the end of the month in which the dependent child turns 26. So there are some organizations that had been terminating coverage on the 26th birthday. That doesn't qualify. Doesn't matter for this year because no penalties are accessible, but starting in 2015, we need to make sure that we're covering kids through at least the end of the month they turn 26. Now, I know a lot of you probably have Blue Cross or Mesa. Their rules allow coverage to extend until the end of the year that children turn 26, and that's the maximum you can go, but it doesn't even have to go that far out. If you wanted to turn coverage to the end of the month, you're free to do that. But that's pretty much as far as they would let that go. And it would be considered also a non-taxable event for the employee to continue coverage on their dependent child through the end of the year if they turn 26. If it goes beyond that, then it becomes, a taxable kind of issue. Before we jump into taxes and fees, I do just want to kind of circle back to that idea of measuring employees because, as you said, this is the area where people most get tripped up because there's a couple of different things all happening at the same time. So you've got your permanent full-time staff, they're getting benefits, you kind of don't really have to worry about them too much, right? Because they're benefit eligible, we're offering, we're all good there. But then you've got a staff of people that are maybe part-time throughout the whole year. And these are your folks who are with you, they're at the beginning of the year, they're at the end of the year, and they're kind of ongoing employees. You're going to establish a standard measurement period that will apply for your organization. And let's go back to the calendar year because that's kind of the easiest. Let's say your plan is the calendar year renewal, and you want to measure everybody based on a October 1 through September 30th measurement period. So maybe that's just an easy 12-month period. We're going to look at all of our part-time hours, measure over that 12-month period. And if somebody made more than 30 hours on average during that period, then we're going to offer them coverage for the next January 1 open enrollment cycle. All right, that's pretty easy. That's what you have in place for ongoing employees, people that are there throughout the whole year. But what happens when you hire somebody new in February? And they're a variable hour employee because we hire them in knowing that we're going to work them part-time in the counseling office, but maybe they're going to pick up something else somewhere else in the district, in the same building or not. They haven't been there throughout our full standard measurement period of October 1 through September 1, September 30. So we have to have an initial measurement period for those people to determine if in their first 12 months of employment, are they averaging 30 hours a week or more, which would entitle them to be offered coverage or subjected to a penalty if not. So if I've got somebody starting in February and my measurement period starts October 1, well, they don't just jump in and get measured for the period of, when they start to my next start my measurement period. I have to measure their hours over one full 12-month period, right? So that brings me February to February. It doesn't jive with my September or October through September period. So all these new people coming in who are variable, you can't just slot into this is a full-time person or a seasonal person. I have to track them over an initial measurement period that's going to run 12 months. Then, at the same time, I have to get them on cycle to be in my regular measurement period, right? So there's going to be a period of time when I could have two measurement periods working for this individual at the same time. I've got my February to February, got my October to September. So let's say during February to February, I get over 30 hours. You then offer me coverage for the next 12 months, right? Because I've earned it over my 12 months, you're going to give me a 12-month offer of coverage. So I get on your plan, let's say March 1, April 1, my coverage is going to go through the next April. Now at the same time, you put me on your regular measurement period that starts October 1. So in the period October 1 through September 30th, now during this measurement period, I don't get the 30 hours on average, right? So even though I'm gonna have coverage through April of the following year, my coverage could end at that point because I haven't re-earned the right to be on based on your standard measurement period. So when Tina Marie talked about the tracking, here's another little challenge for all of you, because it's easy to say our standard measurement period is this 12 months after he's on that cycle. But if I've got people starting in my district at all different times of the year, for their initial employment period, that initial first year, I've got to track them based on when they started, and then I've got to get them onto my standard cycle as well.
So you can have a lot of different, based on how your hiring is during your year, you could have multiple tracking because you have this new hires on this period. Somebody's hired May 1st, their 12-month starts at that period. And again, from a logistics standpoint, having a handle on where these employees are is so critical. So you can know, okay, Megan's period's up now, we're gonna have to offer a benefit or tell her she's not eligible, and then I gotta track Kelly differently versus me differently.
And then, of course, your cafeteria plans have to allow for people to come in and go out mid-year based on these events that are happening. I'm gaining eligibility, I'm losing eligibility. That also opens up some opportunities in the public exchange. So if I've earned eligibility to be on your plan, I'm on your plan for a year, and then all of a sudden I lost eligibility, now I'm off your plan, and it's April, what do I do? Where do I go? I go to the public exchange. That's special open enrollment period for me on the exchange, even though it's not regular open enrollment, I can get in at that time. So it's important that your payroll folks are in sync with your HR folks. You really have to have a handle on these people. And you know, in the private sector, it was just really easy for HR people to say, part-time people, they're under 30 hours, I don't have to worry about them. They have fewer variable hours, you know, in general, unless in very particular industries. But it does have some unique challenges for you in schools and for employees. So does anyone have any like questions, ideas, thoughts, opinions, anything about how this all is or isn't going to work for you all?
Because we're about to throw another monkey wrench in a minute.
All right, let's just keep going on and then we'll
All right.
continue with other questions you
So
have.
the one item, when you look at these variable hour employees and you have these different measurement periods, is you need to communicate to them when they're hired or ongoing, this is how we're tracking, and this is when and if you're measured or you're eligible. So you need to communicate to Kelly employees. Kelly, here's your measurement period. Here's our, it could be ongoing. Kelly's been with your district. Here's our measurement period is from January 1 to October 31. We will notify you in this time frame, and if you are eligible, you'll be eligible for coverage from January 1 to December 31st of next year. You need to communicate that to the employees. When an employee is hired and they fall into that variable hour segment, you need to also communicate to them. Here's how we're tracking your eligibility to see if you are eligible for coverage, and this is what the time frame will be. So not just from ongoing employees in your benefit materials, you need to let them know, policy, et cetera. You need to also do this for any variable hour employees prior to say, here's how we're handling your eligibility. So, what I like about things is for our client partners, we do have, I call it the easy button, but we have these memos in place. So you just plug in your information and it's there for you to include that. But that's something that we want to mention. At least look at, if you have an SPD, you don't necessarily have to as a district, but a plan document, it's an option. I always encourage you to have them because it's a good educational piece for your employees, but include it in language there, as well as your handbook or any benefit materials, or even as a memo, you need to provide that tool to your employees.
Yeah, let's talk about taxes and fees. Three big sources of revenue that are tied to employers, all part of the ACA. There's something called the Patient-Centered Outcomes Research Institute fee, the CORI fee. There's a transitional reinsurance fee that's going to become really a hot button in the next couple of weeks. And then a health insurance tax. And these are all sources of revenue that will flow to the federal government to kind of underwrite the costs of some of these requirements. And we'll talk about what each of those pieces are as we go through here. Transitional reinsurance fee is a temporary tax on employer group plans. So whether you're insured, whether you're self-funded, you are subject to this tax during the period 2014 through 2016. This is money that is being collected from group employer health plans and is going to be handed to insurance companies who are writing individual plans that are for sale in the public health care exchange. Because it's assumed that Some of the people who go to buy individual coverage through the healthcare exchange haven't maybe been covered historically in the past because maybe they were uninsurable. So maybe they're going to have really bad health claim experience, and maybe those insurance companies are going to lose some money in that pool. And so group customers get to help underwrite the cost of the individual underwriting pool for a 3-year period. So 2014 to 2016, employer groups will be assessed this fee. The fee is equal to $63 per covered member in 2014. So this will apply to every covered employee, every covered spouse, every covered child in your plan. In 2015, the good news is the fee will reduce down to $44 per member. And then in 2016, although it's not published yet, the estimate is around $26 per head in 2016. So here's the process. If you are insured, if your medical plan is fully insured, great news, your insurance carrier is doing this for you. There is nothing that you need to do.
Other than pay.
Right, you have paid already. If you have the opportunity to see the monthly premium bills that are received in your district, you know there's a lump sum line item now coming through that says federal and state taxes and fees. That transitional reinsurance fee is built into that line item on your premium bill. So you don't need to do anything. You've been paying for it all year. The insurance company will report this head count and will remit this tax on your behalf. So nothing you need to do. However, if you have a self-funded plan, does anybody in this room have a self-funded plan? Okay. So here, there's a couple things that you're going to need to do pretty quickly if you haven't already done them. The first is you have to submit your head count, your membership count to HHS by November 15th, so just a couple of weeks away. It's kind of tricky because the process to go in and do this only really just opened up last Friday. So you go to this website called, it's not up there, pay.gov, you register your employer, you fill out some information on the form, you're going to report your head count, and that's going to generate the amount of the fee that you need to pay to the government. They've given us 2 payment options. One is to pay the full $63 per head in January 2015. The second is to split that $63 into 2 payments. The first of $52.50 per head in January, with the second installment equal to $10.50 per head due December 2015. It's actually November, I think.
Yeah, November.
Okay. This fee is projected to raise about $25 billion over the 3 years that the tax is in place. So lots of money for those insurance company bailouts here.
Now, what's good for those of you that are self-funded to have to do this, the one piece is you have to register your account pay.gov, and the only way you can pay this is via ACH. So the government is going to come to your financial institution and take the funds out. There's no submitting a check. Everything is done electronically. Fairly simple process to go register in pay.gov. You just need to get what's called an ALC+2 number. It's a special number that you'll need to make sure your financial institution has. It's like kind of like the bank routing number, but it's an additional code. And once you get that from your financial institution, I mean, literally you can register fairly quickly. The second aspect is they have a template that just came out. It's via Excel. And it's just asking for some brief information, and you submit that electronically. So you want to make sure you give enough time from when you submit your information, and it's for 9 months out of the year, before payment is collected, because that's the time frame that CMS is going to take a look at your district and be like, okay, ABC school district, we don't agree with this information, and come back and fix errors. So it's at least 30 days. But what we're saying is, why you have until January to pay the fee. Go out on November 15th and then schedule your payment in January. So you have plenty of time. It's not necessarily due, but they want at least 30 days between when you submit and when payment's collected to allow them to audit your information.
Okay, I don't know if we skipped a slide here. It doesn't matter really. It's the PCORI is the Patient-Centered Outcomes Research Institute fee. For those of you who are insured, again, carrier is taking care of this for you. Nothing you need to do, worry about, report, or anything else. If you're self-funded, you've already made at least one of these payments because they're due July 31st of each year. So you already know this process. So we're not going to belabor that one. But just a question about in terms of who gets counted for these fees, your active employees that are covered. Their dependents who are covered, your COBRA participants, kind of don't think about them all the time. They need to be covered in this count. Retirees and dependents under 65. Now, I think most of your retirees end up in like the MEXRS program, so you're not accounting for them anymore. So less of a concern for you, and the same thing with the retirees and dependents over 65. but it's every person in the plan, every employee, every spouse, every child, every COBRA participant. And there's a couple of different ways that they give us to count these folks. The last one won't pertain to you, the 5500 method, that's for private employers, but the first three are your options. And the first one's not a good option at all because it's the actual count method, which means for January 1 through September of 2014, everyone reports this on a calendar year basis, regardless of what your plan year is.
And it's the first 9 months of the year.
First 9 months of the year. They're expecting you to take account of your membership basically every day of that 9-month period and then average it out. Well, no one in the world is going to do that. It's way too cumbersome. So the second method is the snapshot count method, which says take one day that's the same day in each quarter and use that as your count day. And count up your membership on that day and average that out. So you might say, I'm going to pick the first Wednesday of each quarter, or the last Friday of the quarter, whatever day is good for you, or you've got an accurate count. Add up your folks on those days, average them out, that's your count. This third one is kind of emerging as a favorite because it tends to result in the lowest count for submission, which means the lowest fee that you pay. And so it's the same as number 2, where you take a snapshot of your head count on one day, the same day in each of the 3 quarters. But you take a look at the number of people that have single coverage on each of those days, and then the number of employees who have other than single coverage, so 2-person, employee plus children, family coverage, anything other than single, you count those people up. And then everyone who has non-single coverage, you multiply that by a factor of 2.35. That number you add to your single head count, and that is your count. So if you've got a lot of families, a lot of larger families that have dependent sizes, if their family size is greater than 2.35, this one's going to give you the lowest number of those 3 count methods, and that's the one you want to use because it's $63 times the head count that you come up with. So run each test, or do the calculation for each one. Have that on hand. You're not required to submit your backup as to how you got to the number, but in the event that somebody ever comes to you and says, how'd you get to that number? You've got your paper trail on each of the different ways that you used to come up with that count. Okay, last thing, health insurance tax. You don't have to actually do anything on this. We just want you to be aware that part of the money that keeps the ACA running is industry taxes on a couple of key players in our industry. So health insurance companies, pharmaceutical drug manufacturers, and medical device manufacturers, all as industries have been told, you guys are going to pony up X dollars per year. And how we're going to figure out what your share is, we're going to take a look at your pro rata share of the entire marketplace, and we're just going to assess you that much. So on the pharmaceutical manufacturers and the device manufacturers, you won't see any of that directly impacting your plan, but you may over the years see that the cost of prescription drugs or the cost of medical devices increases because they're now subject to a new tax. And as payers of healthcare plans that cover those items, you may indirectly be paying some of those taxes. This one is a tax on the health insurance companies, and you can see over the years how much money they're expected to raise each year. In 2014, the insurance carriers are going to collectively pay $8 billion into the federal treasury to, again, run Obamacare or the ACA. This is in your health insurance companies, HMOs, anything that's fully insured. So if you're an self-insured plan, you won't have to worry about this tax. If you're an insured plan, actually you won't have to worry about this tax either because you don't have to do anything. Your insurance company's already billing you for this. So you probably noticed this year that your premium, if you're fully insured, went up by about 2 percentage points to account for the carrier's market share tax. They will end up writing this check at the end of the year, but you kind of prepaid it throughout 2014. And this tax, unlike the other two, the PCORI and the transitional reinsurance, does not have a time limit on it. Those other 2 taxes have a sunset date. They will end, they will go away. This tax is forevermore. The percentage that the insurance carriers will charge you will vary from year to year because their market share percentage will shift a little bit from year to year. So you're going to be paying this now going forward if you have an insured plan. But again, nothing you need to do about it other than know it's out there.
And this is a hot button from a political standpoint that you may see in 2016, depending on how elections pan out. I know those that are on the road, having conversations with groups, especially the medical device tax, that is very much a hot button with those that potentially can be in the White House, and that has come up where there's not just lobbyists, but the impact of that. So I anticipate, again, this is the first year it's applicable, that we may see this modified based on the political climate going forward.
Okay. All right, so we're going to talk about the new employer reporting requirements. Tina Marie referenced these a little bit earlier. These will be things that you won't have to actually act on until the beginning of 2016, but it will be reflective of activity throughout 2015. So now's the time to plan for the data that you're going to have to prepare and provide in early 2016. So the IRS has created two new tax code sections, Section 6055 and Section 6056. Section 6055 is necessary for the IRS to enforce the individual mandate. The IRS needs to know who did not get qualifying health insurance coverage, so who should they chase down for that $95 or 1% of income penalty. So they take a look at the whole universe of people in the country, and they're going to weed out those who have Medicare, those who have Medicaid, those who are on TRICARE, those who purchase coverage through the healthcare exchange. The insurance companies will report all of those. But self-funded employers have to report on who in their population got coverage through that plan. So if you are an insured plan, here's another one you don't have to worry about because the insurance company will report this for you. Your plan is insured, the insurance company is going to do this for you. There's nothing on this piece that you need to do.
Well, I want to chime in. You may be asked from your carrier partner to help them secure SSNs for covered dependents. They want you to maybe report that. They either come to you or come to your members, covered members. But the good thing is sometimes we ask for information, right? From an HR perspective, I know I do. I'll ask employees, can I have this information? And Jane says, well, I'll get that to you. You make two good faith attempts to get it, then you're doing your effort to comply. So the one thing that may come that impacts you from this perspective, if you are fully insured, is helping your carrier partner get SSN information specifically for your dependents.
Right. Because here what you're going to report, if you are a self-funded employer, name, address, tax ID number of the reporting entity, the name, address, and social security number for every covered employee and every covered dependent. So as Tina Marie said, you know, for employees, we have their social numbers. A lot of times for spouses, we have their social numbers. You have a new baby who's just added onto your plan. You don't have a social number for that new baby yet, right? It's not going to become your responsibility to get it at some point because it will have to be included on this tracking report. You're going to have to report on the months each individual is covered. So this is a report that literally will have a checkbox for every single month, and you're going to check which ones they were covered. The name, address, and sponsoring employer, and pretty much anything the Secretary of the Treasury decides to ask you on this form.
And they keep changing it, mind you. We're on our second draft, which came out October 15th, and it looks slightly different than the first draft that came out at the end of July. So, and we are not to the final draft yet. So they're kind of tweaking what information is necessary, what information is not, but the core information we mentioned here is still on that form, and we anticipate it's going to stay going forward.
Great. Thank you. All right, so how this is going to be reported. Individuals, if I have a fully insured plan, are going to get a form 1095B. This form is going to come to me as an individual in the same time that I would normally get my W-2. So it's going to be January of 2016, reflective of coverage that I had in 2015, because when I filed my 2015 tax return, along with my 2015 W-2, I'm going to be sharing this information with the federal government. So they know I had coverage. They do not need to pursue me to collect an individual mandate penalty. All right? So the forms for me as an individual will be in the timing of a W-2. As an employer, if you're filing this, you will be filing in the end of February or the end of March if you file electronically. What you're going to have to do is file a copy of each of these 1095s and give it to the employees along with the transmittal saying, here's all the stuff that I gave to my employees.
It's a compressed format, just like when your payroll area is submitting information for W-2s. It's compressed. It's not the length form you're getting every employee. Just information that's reported on that format. If your carrier, if you're fully insured, your carrier will be getting this information to your employees. So whoever reports it, carrier or self-funded plan, the employee is going to be notified, regardless what entity, what information was provided to the IRS.
And then again, notice to employees, the reporting entity will provide the individual statement. This also includes retirees, which you don't have to worry about here, but also again, those COBRA beneficiaries. And you can't forget about those people. They're still tied to us for reporting purposes. The insurance carrier will use the 1095B. And again, the individual statements due to employees by January 31 each year, same timing as your W-2s. the insurance carrier and employers reporting to the IRS, probably most of us will do it electronically.
So the good thing is, for the self-funded, one or two of you that are self-funded, the government recognized that you're gonna be filing a lot more than your carrier partners. So they said, you know what, you don't have to do a 1094 and a 1095. We're just gonna let you use 1095C to report both your obligations under each of those sections. So because a lot of the information is the same, it's redundant. So they allow you just to give the employee just that 1095C.
So now, section 6056 will pertain to everybody. So this is one where you don't get the pass if you have a fully insured plan. All employers with more than 50 full-time employees will be filing this form. And this is to enforce the employer mandate. So did you, as an employer of an organization with more than 50 full-time employees, did you offer qualifying health care, was it affordable, all of that information to know whether or not any employer penalties are accessible to you? It's also to enforce the marketplace subsidies. So if you're reporting an employee as covered under your plan, who also inadvertently got a marketplace plan and got a subsidy, the IRS needs to know that person wasn't eligible for a subsidy and needs to then pursue that individual to get that subsidy repaid. It's kind of a twofold purpose as to what's going on with this one. So as Tina Marie said, a lot of the information is the same here, but you're going to provide your name, address, tax ID number, who's the person who's reporting, who's the contact person, the calendar year that you're reporting. So again, regardless of what your plan year is, everybody will report on a calendar year basis. And you're going to have to certify that you did offer coverage to full-time employees and dependents, as we've defined them, the natural children and adopted children, that you have offered them the opportunity to enroll in minimum essential coverage. Okay? The months the coverage was available, they're going to ask you, how much did you charge for single coverage in your lowest cost plan? That's going to take us to that 9.5% affordability threshold. They're going to want to have that information. They're going to want to know the number of full-time employees for each month. So if anybody was under, over 50, were they subject, were they not subject? The name, address, and social security number for each full-time employee and the months that they were covered. And then again, anything else the Secretary of Treasury should decide between now and January 2016 that they want to acquire from the employer. There will be some places on the form to indicate whether your plan met minimum value standards, meaning that 60% actuarial value, whether you did indeed offer coverage to spouses even though you weren't required to, what was the waiting period for new hires, general information like that about your plan. So this one's going to be a little bit more involved. Same timing, again, employees will have to receive their individual statements by the same timing as their W-2s, so end of January 2016, reflecting of what they had covered in 2015. You will file the employer transmittal report by the end of February or end of March if you're filing electronically. And hey, if anybody wants to be a pioneer here, the government is accepting voluntary compliance in January 2015 for anybody who wants to report on 2014.
And again, I'm not an attorney, but I would highly advise, and I will tell you, good attorneys have told me, never voluntarily share information with them if you don't have to.
Yeah, we're going to have to put the takers on this one.
Yeah.
So you will use a 1095C to report to employees, and then it's a 1094C, the transmittal to the government.
But again, self-funded, you can use just 1095C to do both reporting obligations, because again, that information is redundant, so they're recognizing it, your administrative burden for giving you the load.
So expect more guidance and information to come out about this. As Tina Marie said, our company has just put together kind of a 6055, 6056 reporting toolkit available on our website. We'll share that information.
We also have a webinar coming up from our compliance area that's very good, helpful information that kind of dives further into this. And if you're interested, we'll be more than happy to get you information on that if you want to truly dive into that section further.
All right, getting to the end here. Out-of-pocket maximums. If you have a qualified high deductible health plan where you're offering a high deductible health plan with a health savings account, the numbers for maximum out-of-pocket expense and deductible are changing in 2015. So if you have this kind of plan and you have a $1,250 deductible, that has to be at least $1,300 for a single person in 2015. And the maximum out-of-pocket expense for that plan, $6,450 on a single, $12,900 on a family. Now, in all other types of plans, the maximum out-of-pocket expense that you can have in 2015 is going to be $6,600 per person, $13,200 per family. And keep in mind, again, these out-of-pocket expenses now have to include everything that a member pays out of their pocket, so their deductible, their co-insurance, all of their fixed co-payments will apply to that out-of-pocket maximum. That's as high as it can be. Of course, most people don't have them quite that high, but that's the maximum that you can have in 2015. A couple of things we're still waiting on. These were part of the original law signed in 2010. If you remember, there was something called automatic enrollment or auto enrollment we were all supposed to do, where new people coming in who were going to be benefit eligible, we were going to automatically enroll them in the default plan and then allow them the opportunity to opt out if they didn't want to. We haven't had any guidance on that yet, so we don't have to do that yet. We continue to enroll people just the way we always have, but that's still out there as a loose end. There were some non-discrimination testing rules that were going to be written to govern insured plans. Self-funded plans already are subject to some non-discrimination testing rules, so they were going to do something similar for fully insured plans. Still waiting on those. And then there's something out there called a quality of care reporting that is mentioned in statute. We don't know anything really about what has to be in it, but ultimately the vision is there's some sort of reporting on wellness initiatives and just measuring the quality of care and the types of things that are being offered as part of your health plan, some kind of reporting on that. So those things are still out there, loose ends. They're in the statute, haven't been repealed, haven't gone away, but we haven't gotten any guidance on them yet either. And don't forget about that infamous Cadillac tax moving in 2018. When this was passed in 2010, 2018 seems a million years away. Well, now we're going into 2015, it's not quite so far away. And this is a tax that says if in 2018 the value of your plan is in excess of those numbers that you see on the screen there, 10,200 for single, 27,500 for family, then there's a 40% tax that will apply on that excess amount. So if you have an insured plan, your insurance carrier is going to have to pay that tax. And just as sure as night follows day, they will pass that along to you. If you have a self-funded plan, you have to consider what you're going to do with that 40% excise tax and how you're going to share that back with your employees. So not impossible. When we saw those numbers initially, it was like, oh, those are pretty big numbers. But there's a lot of fairly generous plans out there that could be on track to hit those numbers. So just kind of keep that in the back of your mind. We put a couple of resources out here. Our website is ajg.com. That's pretty easy. Arthur J. Gallagher, ajg.com. And then if you go to that homepage up on the top right, there's something you can click on called Knowledge Center, and then click on Healthcare Reform, and this enormous cache of resources will open up to you, including access to all of the toolkits. So the reporting toolkit, there's an employer shared responsibility toolkit, there's a W-2 reporting toolkit, just numbers of different things. There's an FAQ. At the time, it was up to 415 questions, actually more than that now.
Yesterday, they just increased it.
Yeah,
So.
pretty huge. Several different webinars on healthcare reform related topics. So if you ever want to listen to any of those things, they're on demand. You register yourself and listen at your convenience. And then, of course, every newsletter that we've ever written since the beginning of time on this topic, so all the way dating back to 2010. There's a particularly good piece out there called Key Considerations in Avoiding and Calculating Blah, blah, blah. Very nicely done piece. It's about 24 pages long, but it's a great overview. It doesn't go too deep into anything, but kind of talks about everything that you need to know about healthcare reform. So a lot of good resources available. And
The only other thing we wanted to mention is just some strategy, and that's why we made Megan come and play Vanna today. But Megan has actually done some things with some districts in Southeast Michigan with those districts that have a small segment of employees that they've looked at the risk and they said, you know what? We are not going to offer them benefits. But we want to be able to do something to help them. Well, we looked at the example that was given where we have these 28 individuals and we know that we're going to be okay, but we want to give them an option because guess who your employees are going to? They're going to you first as a trusted advisor, as an employer to say, here, what are my options? And again, some districts don't want to be that individual to have that conversation because some information you don't know. You don't know their household income. You have so much on your plate balancing operations and other challenges that you don't want to be a resource on this. So what Megan has done is gone in and talked to individuals and gave them more guided advice as an licensed insurance advisor to be able to say, okay, here's the marketplace. Let's go to see if you're eligible. Here are your plans. Maybe this makes sense. Maybe it doesn't. Guiding them to Medicaid because again, some individuals they've expanded Medicaid in Michigan. Maybe they're a lower wage employee and they don't necessarily know they're eligible for benefits. So she's been able to help in that regard. And it's a strategy. Again, at the end of the day, the best thing we can tell you as a district is you need to look for the path that best meets your needs as a district. And again, as you're looking out to recruit and retain staff, especially because you're a service provider, and maybe you have those teachers' aides in your preschool programs, and you're not offering benefits to that, or they're not in a CBA, but you need to have good quality staff in that area because that reflects on your education values. So looking at things you can do that maybe are outside of, you can't offer them benefits, maybe you don't want to offer them benefits, but there's another option. So we brought her along. If you have any questions with her, again, she's very knowledgeable in the marketplace. But again, something else to consider, that you have an option. Nothing says one option is better than another. You just have to, as a district, make the best business decision for your needs and your employees. So
We also do quite a bit with people going out on COBRA. So anyone who is trying to choose between COBRA and, you know, an individual plan, I can tell you there's not a single person, since they've gotten rid of pre-existing, that is better off on COBRA unless you've already met your maximums, whether it's a deductible or out of pocket. So that can be another alternative for them.
So employees get sticker shock, right? Especially with the benefits you offer in the district, and then they get the COBRA and they're passed down on the floor. So again, that's just another option. Are there any questions that you have? Again, some of the challenges you may have logistically in trying to gather all this data or kind of figure out, get a gauge on your population, who's eligible, who is not eligible, that we can guide you. Again, we've kind of thrown a lot at you this morning, and again, a lot to digress in a short period of time, of course. Any questions? Well, we definitely appreciate the time this morning and having the opportunity to come back and share a topic that is in high demand right now. And we're all empathetic with you, that we understand it's a challenge and we're all in it together.
We'd like to thank you for coming. We really appreciate it, and coming back and doing a more lengthy presentation. So thank you very much.
Thank you so much.
I know.
How do we, is this on class? Yeah, we're probably gonna have a little conversation with you at some point. We do have some employees in our Head Start group, and in their COBRA is a really good voice that I heard Rhian about COBRA is tough.
Yeah, it's also, you know, people that are continuing to be on your plan and your
Right.
things like that. So, our clients, and those are the easy, you know, one-off, and people really appreciate the help. And when they're on COBRA, it means they're not working, which has their household income to fetch that you're subsidy eligible anyway. But even if they're not, just knowing they need something, COBRA is way too expensive. You know, there's 45 other options.
Right, and she's gone. You're going to have somebody to contact her.
Oh, she's great.
Thank you so much.
You're so welcome. I'm so glad that we could do it.
We do, we really appreciate it.
I know there was some faces of like. That happens a lot when we talk about health.
Right, so much.
Thank you very much.
So we can't just offer cash. I'm just kidding.
You can, as long as it's in the context of a qualifying section 125 plan.
Yeah, let those
We don't want to hear about the.
I'm just gonna live in the van under the bridge.
We're selling t-shirts, that's what we said we're gonna do. We're going to the Keys.
I like it. Margarita Bell.
Got a whole bunch of people that said that year, I'm gonna retire.
Good.
Be eligible would be nice.
Yeah, I know, you guys are way too young.
Thank you.
You're welcome.
I usually give a lot of our clients like a little one pager that.
Isn't our security?
And Carrie's getting a little bit more well versed in it. I know.
Yeah, many times it's city hall. Yeah, I mean, I'm just thinking of your password. Some of them. Sure. Yeah, of course. The only thing is, we do have
Right, to leave it on like that.
I know, so that was good information.
And I know it's sort of different in the school district, but in the private sector, most people are very different.
Well, and that's why we just took other enrollment out, and, you know, honestly, we took every, we used to require, you know, because the reality is. Well, you came into quite a fun, I thought maybe.
I guarantee you, food and it's been here, right?
And we, especially when you know, they can still buy whatever they want. They just realize that doing that will send their money out of expensive plans, all that they have available. Just, you know, they were trying to do something good for their employees and it ended up hurting them.
Well, I'm glad that got good. Yeah, that's, you know, I was just trying to figure out.
Well, our first you know, whatever the cap is.
And there you go.
State legislators.
Yeah, I know. Believe me, you weren't the only ones.
No,
I don't think so much.
You guys
Facilities are across the line.
I'm gonna use the restroom. I don't know if you're like me, I don't know how you guys did it.
Thank you for arranging to have us back. Your flash drive is still in there. I think it's on that little team thing.
Are you guys, do you
No,
have
I took
everything?
mine out.
Oh, you did?
Yeah, okay, that's why Teresa.
Pictures. Okay.
That's not me, but.
That's nice. Cute.
Okay,
All right, thank you very
I
much.
just wanted to say.
Yeah, you know she.
Yeah,
had
she's.
come up. Okay,
yeah,
great.
yeah, I know
I
she
should have said that.
I know she did. No,
No, she.
It's a long drive for her to.
No.
We were just coming up, we've been here.
So how long were you up?
Monday, Tuesday, yeah.
Were you staying at the?
We stayed at the park, it was the first night, and then we're in Traverse Tuesday.
That's nice, because you're right downtown.
Yeah.
Did you go to Traverse?
I have a little place. I call it, which is, if you go right by the resort, if you went 10 more miles, that's
Okay.
There is this little gem. It's right in the park place, it's like right on the other side of the street.
Really? I'll have to remember that one, because you know, everybody talked about Stella's, and I've been with Stella's for a time, but
Sorlina.
Okay, Kiki's little sister.
Yeah.
It was. We were talking before, having been there, and he was talking about. Make sure that the shoes. They have been made stressing balsamic. It was literally like, oh, I'm so glad.
Oh, you just wanted to cry. It was so
It
good.
was so good. Which literally, I told them, I'm just like, almost like, you know, very tired. I'm like, this is the most amazing food I had ever.
Oh,
Like,
that's very nice, yeah.
Oh, man, I have to remember that, because we had a place that we would go to up there at night, and that closed, and us and Stella's is just too good.
Okay.
So
We went in and they
Yeah.
have like a side of the restaurant side, they had like a outside and it's happy hour all day. Not that we were in there drinking, just we were there to eat, but we were asking them, so how was it going? So I got the local phone that come over the bar and have a local wine or whatever. They have like small appetizers, so you can try. We tried some salad, and I guess the sort of salad, he has this homemade balsamic something. It was just. Megan literally, her and I on our plates, we're taking the bread and just.
Oh my God, it was really good. You know, it's just a real foodie place.
It really
There's
is.
City to
Oh,
City.
we were
I mean, I mean, you can just go to foodie.
It really, yeah, who knew?
Yeah.
So he was telling us that they have another place, I can't remember what it said.
Was it? No.
Yeah, Hutchins.
Huntington's or
Something like that, I don't know, St. Lawrence, and then they're gonna open another one on the grounds of the Grand Traverse Resort. There used to be like another restaurant somewhere.
It was on by the golf,
On the
and they
property.
sold.
Oh,
this
yeah,
building.
yeah, yeah.
Yeah,
It's been closed
closed.
for
He's
years.
opening
Yeah,
up, it's gonna
yeah.
be an Italian little brother. And I forgot
Oh, I know
Travis
exactly
something,
where that-
but he
It's like
it was,
Trattori's
oh yeah, it was
or
Italian.
something like
Yeah,
that.
that's what he
Yeah.
bought.
Yeah.
So he's reopening it.
Okay, I know exactly where that
More
is.
choices for them.
Oh, yeah.
That's closer to me, you know.
Right,
It
right.
was like, this was the nicest man. He said, yeah, I was a golf pro for 19 years. I said, what do I want to be when I grow up? And he has this passion, and he opened, it will be his third restaurant.
I mean, you literally can go up there and just eat your way through.
That's what we,
Yeah.
that's
Because
what
you can go
happens.
from place to place, and there's so many places that have all these just.
And then you throw in a couple of wineries too. you know.
Oh my goodness.
We didn't do
We
that.
no, we never went to any.
I know.
Yeah, it was, it's a good time up there.
It really is. So their farmers market's awesome too.
Yeah, we keep missing
In Traverse?
Uh-huh.
Really?
They have a phenomenal farmers market on Saturday morning.
Oh, good to know. I've never been there during the, or on the weekends.
We're
Yeah.
talking
During the
food.
week.
Of course.
I'll let you talk. We're just exchanging where I'm gonna go eat.
Yeah.
Oh,
you wanna go?
You have to go. So very nice to meet you.
Thank you.
Yeah.
Oh, okay. Appreciate it.
We were just talking about, you know, you have to make the offer, and so we always have employees that don't take insurance, and we've kind of come up with we call it a declination of benefits, but, you know, but we just wondered, how often you have to document that you made them an offer. So let's say you hired the employee in 2008, they filled out the form saying they decline all benefits and signed it. But for now, for the purposes of this, do we have to have them decline it every year to show that it's an offer?
You don't have to have them redecline it every year, but you might want to have them redecline it one more time and maybe update the language in that decline of offer to include something that says, like, probably not right now, it says, I understand, you know, I've been offered, I'm declining, and I'm locked out till next open enrollment, and, you know, blah, blah, blah. We were talking about adding also some language that says, I understand that the plan is considered affordable, it is considered minimum value under the ACA, declining, so that it's mostly just to protect you in the event that somebody comes after you from for, hey, you owe us $10,000 for all these people.
Okay.
No, here we go. And then maybe you say on your language also, this, my declination is evergreen and continues on until such time as I revoke it. And you know, just kind of beef up the language a little bit and get them kind of one more time.
No, and there's nothing that says you have to, but I will an option and cover your, and again, that's just another substantiation. Again, you're submitting the 60/50, well, you have to do both.
Yay.
But, well, really only one, because it's the same information, but you're basically telling the IRS, I've made an offer, and here's what we've done, coverage is available. So that is one way